I will start this Congress with some news which are not very good. And the news concern exactly that portion of the human body with which homeopathy is dealing primarily, which is the immune system. As you all know, it's the defense mechanism of the body. In homeopathy, we just try to strengthen the immune system, strengthen the defense mechanism in a more general sense. And as you know, the immune system, or the breaking down of the immune system, is the cause today of a very severe, this fatal disease, AIDS. You see, I don't believe that I can teach you anything in 2 days. And I see some old students of mine coming here and expecting to have some new knowledge. I don't know if I can provide that finally, but what I want to do today is to make you aware of what is happening in the world today concerning health in general. And I start by giving you a story which took place 14 years ago in Athens in 1972, while I was lecturing in a group of medical doctors in Athens. Based on my experience so far, an experience of about 12 years at the moment, cases that I had seen in depth, cases that I have taken all the history and see what happened and why it had happened in that person, why this person was sick today and he was coming to see me. Based on that experience, I predicted in this particular night that if antibiotics were kept on pumping in the human body in the way that they were pumped through the allopathic profession, soon we shall see that the immune system breaks down and opens up into a new set of diseases that are going to be very severe and most probably incurable. In 1979, I had read an article in Time magazine that there were about 15 new diseases appearing at the moment. The Legionnaire's disease and many others that were entirely new and their cause was unknown. And of course it was 1981 or 82 that the question of AIDS arose, and in 1986 we have very bad news concerning AIDS, and I will like to read a little bit from a report published in an American magazine. And that report comes from Dr. John Seal, a leading British expert on AIDS. And the report says that the first question that an ABC reporter asked Seal, it was why all the medical authorities disagreed with him. And Seal pointed out that in '83, he had said that AIDS could be transmitted to women. All the medical authorities disagreed, and now he's proven to be right. He said that AIDS could be transmitted to babies. Everyone disagreed, and now that has been proven true as well. In '84, he said the blood supply was tainted, and the Red Cross said it was impossible. The authorities have been wrong on every issue before, Seal said. So why would they be right now? So Dr. Seal made an appearance on television in October 2nd, last October. There he immediately clashed with other panelists who denied the possibility of transmission of AIDS among children. There is no doubt, he retorted, the scientific evidence has now been published that AIDS can be transmitted from one child to another. I'm sorry, but it has been published in The Lancet, the very important scientific journal from England. The case just published 2 weeks ago of a 3-year-old boy who had a blood transfusion and died of AIDS a few years later. He infected his brother by biting him. It's all been published. And this incident was in West Germany. There were about 7 doctors who wrote these articles. They checked with their governments because of the implications of this before publishing it. This is like the famous case of the first known infection by a blood transfusion. It was supposed to be impossible until the end of '83. It was denied in the United States that this was possible, and now it's a well-known fact. As we go to press, Dr. Seal was scheduled to give a press conference at the National Press Club in Washington, D.C. on October 3. The following are excerpts from the testimony of Dr. Seal before joint hearings of the California Senate Health and Human Services Committee and Assembly Committee on Apportionment and Elections in Sacramento on September 29. Dr. Seal is a member of the Royal College of Physicians and runs a private practice in London specializing in genitourinary medicine and sexually transmitted diseases. In early 1983, he started studying the epidemiology, pathogenesis, prognosis, and transmission of AIDS virus infection, and has published numerous articles and letters on this subject. He said, "I'm honored to have been invited by the Senate of California to testify before your committee today. This is the second time in 4 months I have been invited to the United States to speak about AIDS. In May, Mario Cuomo, governor of New York, asked me to speak on the impact of AIDS on public policy. Today, I have 15 minutes to explain my endorsement, etc. Some of you are old enough," and then he goes on and he quotes Professor William Hastline of Harvard University. And he says that this professor believes that 100% of people will die within 20 years or so of the infection. That means nobody will escape. He calls him a pessimist. As is the case with, this is why he testified before a Senate committee in Washington a year ago that AIDS was species threatening. Professor Harvard. In simple English, Professor Hastling believes that AIDS virus has the capacity to spread and to kill every man, woman, and child on earth. And the optimists, like Professor J. Levi of San Francisco, believe that a mere 50% will die following infection with the virus. The other 50% will come to little or no harm. This optimistic vision makes AIDS twice as deadly as smallpox and as deadly as bubonic plague, the cause of the Black Death in the 14th century, which killed 1/3 of the entire population of Europe. He says, what are the prospects of a cure? Once the pro-viral DNA is spliced into your own genes, no product of the pharmaceutical industry will ever get it out. Any drug which blocks the replication of the virus, which is the most that can be expected, will have to be continued for life. And the prospect for a vaccine. Few of the antibodies that are naturally produced are neutralizing. Some of those that are get knocked out by antigenic shedding. Most of the in vivo cytopathology is immunologically mediated. Intercellular spread of the virus during membrane contact evades antibodies. Antigenic drift is continuous in every infected host. All these factors combined make an effective vaccine theoretically impossible. And then he goes on, he proposes that Mr. Reagan and Mrs. Thatcher and other people leaders of the world, they come together and they take measures. In 1974, I started writing my book, The Science of Homeopathy. And in there, I have seen the effect of syphilis treated by antibiotics. And I have stated in this book, in the first edition of this book, I have stated that syphilis is not really cured by antibiotics, but it is rather suppressed and will appear in other forms eventually. The same I have seen with gonorrhea, where the numbers of non-specific urethritis were enormous as a side effect or a consequence of gonorrhea. We have people infected chronically with the secondary or tertiary stage of gonorrhea. When I wrote this in my book, I was attacked by especially English doctors, and they claimed that I was wrong, saying that syphilis was not cured. Syphilis was cured by antibiotics, especially by penicillin. When I examined the cases of AIDS, as you all remember, it was attributed to homosexuals. It says if you are homosexual, then you run a high risk of getting AIDS. It proved to be nonsense. Why it was homosexuals in the beginning? Because homosexuals, especially in America, became very promiscuous. There were people that they will have sex, excessive sex with anybody, under any circumstances. As a fact, they contracted syphilis and gonorrhea very, very frequently. So if one would examine the histories of such people, they will see that they have several infections of syphilis and gonorrhea the last few years. And all these infections were treated constantly with antibiotics. Not only that, but this specific group would take antibiotics as a prophylactic, because they will go and have sex with somebody they never knew or just met the other night, and prophylactically they will go and take antibiotics to prevent themselves from getting syphilis or gonorrhea, from getting a venereal disease. But what is AIDS? AIDS is a venereal disease. its mode of transmission is exactly the same as syphilis. The difference is that AIDS virus is much more subtle and much more deadly than syphilis. So what is happening? We have to ask what is happening with the question of AIDS. Was it really the homosexuals or the way that perform sex, or was there really another factor? Very soon it proved that other groups, heterosexual groups, were in risk. Which groups? The promiscuous one. Those that they will have sex indiscriminately. But what was involved in this group as well? It was the same factor. They would get easily venereal diseases, and they would have to be treated again. And then, what was the next group from women? Was the prostitutes. Of course the prostitutes, because again, in the prostitutes, the risk of getting a venereal disease is very high. So I was talking with a group of professors from the University of California last year, and I was expanding these ideas. So he said, now wait a moment, why the Tahitians have such a high number of AIDS? Well, I said it's very simple, because the homosexuals from New York, they will fly to Tahiti and find a partner and have sex, and then they will give to them their venereal diseases. As a result, they had to be treated with antibiotics over the counter. And these people were getting very frequently venereal diseases. Now, says, what about Africa? In Africa, AIDS is becoming an epidemic. Why? I said, because in Africa, the last 10 years, there is an epidemic of syphilis and gonorrhea. It's breaking up a tremendous epidemic that infects almost everybody with syphilis and gonorrhea. In the end of the discussion, they went back to their computers. I mean, they had a lot of objections in the beginning, but in the end, they said, well, it makes sense. Let us see. They went back to the computers and they asked the computers how many people of the subjects of AIDS they had antibiotics the last 6 months. The percentage was tremendous, was 85%. I mean, do you realize what is coming? If venereal diseases are not really treated, or if they are treated, they break down the immune system, and they bring the immune system to such a state where the AIDS virus can live and exist and thrive. Can you imagine how many thousands of cases you will be expecting to die within the next 5 years? And the whole question of AIDS is not tackled properly. Because they say an acquired immune deficiency system, an acquired immune deficiency syndrome. Acquired by what? The immune deficiency they describe it as acquired. Acquired by what process? And when we come to homeopathy, we have the theory of the miasms, the miasmatic theory, right? In which all these ideas are based. And we have been talking about the miasmatic effect of syphilis and gonorrhea for years. And we have been shouting that these venereal diseases are not really treated, but they are going through the human system and undermine the system. And here comes the prophecy of homeopathy to be frightfully true. I'm afraid that nobody at this stage has realized the importance of AIDS. And unless we really understand the cause, I mean, do you understand if that theory may be true? May be true. I don't say it is true at this moment. Though I collected the facts. And I together with an assistant professor in the University of New Jersey, collected the facts and sent this paper to be published in a scientific journal. But if this theory is true, do you realize what we are heading on as a human race? Breaking down the immune system by pumping into the human system tons of so-called allopathic drugs. And I believe that it is every chemical substance that goes into the human body that can cause a compromise in the immune system. It's not only antibiotics, it's not only cortisone, it's not antihistamine drugs, it's every drug. Also the hallucinogenic drugs, that they cause a compromise in the immune system and prepare the system for that disease which we call AIDS. AIDS is nothing else but the last stage that the human body, the human organism can reach. After this stage, there is no hope. And the homeopathy, if you ask me, homeopathy can really cure AIDS? I said no. I will say no. There is no hope. I don't believe that any drug will ever be effective in that state. Homeopathy cannot cure AIDS. But what homeopathy can do? Homeopathy can be used to strengthen the immune system. There is no question about that. So that the organism will not eventually reach that state in which the virus develops. Therefore, homeopathy will become very important in the very near future in treating diseases in general. And that's why I said it's great hope to see so many numbers interested in homeopathy at this stage. Because I believe that this is the only system actually, together perhaps with acupuncture and some other natural methods, that they may bring some hope into the human race. I mean, the man concludes here, the doctor concludes here, that it may be that's already too late. The virus may be unstoppable everywhere, he says. I don't know. I don't think that at this moment people in general realize in what state the general health of the human race is at this moment. This is a very important message, because if that is understood, then homeopathy maybe will be taken its right place. And maybe homeopathy does not have to be taught in this way, in weekends or in seminars of 15 days or 20 days or even 4 or 5 weeks that I was giving the seminar in United States. It has to be taught in a university setting in a course of 3, 4, 5 years. So I know you are all interested to hear about my ideas about skin eruptions. but you understand my position. When I read this, I am in the United States, and I feel what is going on. And I feel, I see in the television almost every day discussions about AIDS that have nothing to do with the real issues. And the real issues are never discussed by anybody. And I tremble. I say, now what is going on? And they try to accuse now different things, and they say, oh, well, why the virus is now in Africa, and they don't realize that in San Francisco, in New York, are going to become deserted towns in a few years. Everybody will fly out in hysteria out of these towns because of the fear of contracting AIDS, unless something is done quickly. Something is done which is essential. So we have an immune system which is compromised now. What can we do for that system, to help that system? This is not the question at the moment. If this is not, what I say is not realized, people are keeping on taking antibiotics all the time, keeping on taking strong drugs to treat diseases with the hope that we will become well. And when AIDS comes to the last stage, they still give antibiotics, sending much faster their people to the next stage. Skin eruptions. According to the model I have presented, and I believe you are all familiar with that model, and the model of homeopathy in general, skin eruptions is a very good state to be. I mean, to have a skin eruption now, it's like a boom. You see, give me a skin eruption. This is the idea. This is the idea with homeopathy. If the disease is on the skin, is outside, this is great. Everybody who takes homeopathic treatment says, give me a skin eruption. Now you are asking me to tell you how to get rid of this. How to get rid of the skin eruptions. I mean, tell to your patients Fine. You reach that stage where you can't afford to have a skin eruption. That is fine. Keep it. I'm not joking. If it was to be seen the state of health in which we are, I mean, if we had a way of projecting the inner disturbances, mental, emotional, and physical, into the skin, into the outward part of our bodies, there would be no body without skin eruptions, bigger or lesser. So once the body under homeopathic treatment reaches that stage of producing, bringing out skin eruptions, then there is a great hope for that organism to live considerably healthy after that, even if his skin eruption remains for good. Now here I want to make a correction concerning Peter, what Peter said, that I have said, many times I have heard that, I have said that in Athens we cure 100% of the skin eruptions. That is totally wrong. I'm sorry. But no. What I said, it was that, you know, in the Athens there are about 30 medical doctors working in the center. 4 of them are pediatricians. So they did statistics. They took all the cases of psoriasis in children. That specific skin disorder, psoriasis in children. And they followed up the cases. They telephoned, they saw the people, and they said, okay, we had so many cases. This was a paper was prepared for a congress for the Panhellenic Congress in Greece. So they brought me the result, and they said, according to the statistics, every case of psoriasis that we had in children, it was treated successfully, and the paper showed 100% results. And this paper was prepared to be read also later on in the International Congress. And I said to them, forget it, make the results less, because nobody will believe. But it was only in psoriasis in children. So after this introduction, I would like to clarify this issue, actually, because it's very important and an issue which is misunderstood in homeopathy. We have to consider, actually, on skin eruptions, we have to consider 2 big groups. The one is that the people that they come to be treated initially come to be treated for a skin eruption. That they have this skin eruption for years, and they come to you to be treated for that. Though, as you know, very, very few people that still have their skin eruptions, because their skin eruptions were usually suppressed, gone inside through cortisone mostly and mainly. They put cortisone and the skin eruption disappears. I mean, you cannot see it anymore. And you stop cortisone and the eruption reappears. And you put cortisone and disappears. And you leave cortisone and reappears. And that goes on for a few years, depending on the strength of the organism. And one day, the last applying of cortisone is the final, and the eruption does not reappear. And the patient usually will say, well, I don't know if cortisone did anything really, because I was, using it, and the eruption was coming out, and using it again, coming out. And I'm not sure that that cortisone really cured my skin eruption. The fact is that the immune system, as long as it was strong, was bringing out the skin eruption. In spite of cortisone, the skin eruption was out until such a day as the immune system was damaged and could not anymore have the strength to bring out the skin eruption. And that's why the skin eruption finally stopped coming out. And that is usually the story. They will say, well, after a particular year, I do not have my skin eruptions anymore. Because you are asking all the time in your history, did you have a skin eruption somewhere back in your history? Yes. How long it lasted? 2 years, 3 years, 5 years. Depending on what? Depending on the strength of the immune system. Now, if that skin eruption is pushed inside, is going to create a lot of problems. And I hope to be able to show you, perhaps tomorrow, perhaps they will see, a case where you will see very clearly what happens with the skin eruption when the skin eruption is pushed inside into the organism. So it's a good prognosis when somebody will tell you, I had a skin eruption for 20 years. That means a strong organism that is not admitting suppression very much. If somebody tells you that I had a skin eruption, I put a little bit of cortisone and it's gone, it was gone. The skin eruption was gone. That's not a good thing to hear. That means the defenses of the body are already too weak. And the stories that you hear usually is when they come to you that the skin eruption was there, was suppressed or cured, quotation marks, and the person now is suffering with ABC3 symptomatology. Once you treat successfully such a person, you may expect that the original skin eruption will eventually come back. Now that is the second group. The first group, he came for a skin eruption. The second group is cases of skin eruptions that they came after your homeopathic treatment. You treated somebody homeopathically and he developed a skin eruption. What are you going to do? Somebody came and said, well, I have my skin eruptions for 20 years. What shall I do? There are two different groups. On the first group, where the person says, comes to be treated for a skin eruption, you may try immediately and find the indicated remedy, right? And this is a whole process, as you know. You go to the general symptoms, mental, emotional symptoms, and the local symptoms of the skin eruption, taking all this into consideration and try to find out the best possible remedy. In the second group, where you produce, after giving a remedy, the organism brought out a skin eruption, that's a different story. Now, if in such cases you try immediately to treat that skin eruption, you are going to have big problems for different reasons. The first reason is that once the organism has been stimulated by the right remedy and brought out a skin eruption, the remedy usually is not apparent. You cannot find the right remedy. Now, what are you going to do then? then you have to let the organism fight it itself. You have to let this patient go on with the skin eruption. For how long? Well, the how long depends mostly on the severity of the skin eruption, right? Because sometimes the skin eruption is very severe. Then you may have to act much more quickly than another skin eruption that is not as severe and can go on for 6 months, 1 year, 2 years. A skin eruption can be left for 2 years. And another skin eruption has to be treated within 2 or 3 months, but not earlier than that. Because once you gave the indicated remedy and acted beautifully in bringing out the skin eruption, then you have to allow the system to do its best under that remedy. If you try now to treat such a case very quickly, because the patient comes and says, I'm itching, I can't sleep, or I can't have these eruptions in my face or in my body or whatever. And they press you. And you try to prescribe for these cases. Most of these cases are spoiled. What is the worst that can happen is that the skin eruption may again be suppressed back to the original case. Sometimes it is impossible for a homeopathic remedy to suppress the skin eruption entirely. So what will happen is some of these skin eruption will go inside and some will remain on the outside. So it will be a distribution of disturbance. Don't forget that diseases are not material entities. Diseases are in the mind. Diseases are in the emotional. And diseases are on the physical body. Now the total of, if you add up the disturbances on the mental, emotional, and physical body, if you add up these numbers, then you have the final number of the disease of the individual. So, when you have a skin eruption, if you have every disturbance of the human body that it has appearing on the skin, you're going to have a very severe skin eruption. In such a case, do never give a remedy, at least immediately. Wait until the indications of the organism in general give you enough information to prescribe on a new remedy. Do you want to spoil your cases? Try to cure these eruptions. Also, we have different groups of skin eruptions. Skin eruptions, I mean, it's a generic term that does not really give the does not really give the idea does not really kind of skin eruption. There are skin eruptions which are much more mild, and are skin eruptions which are the externalization of a dysfunction of a vital organ like liver, or the absorption system, which has gone wrong, or the hormonal system, which has gone wrong, and therefore we have different degree of severity in skin eruptions. Now, is it possible? I have tried to give you an idea of a hierarchy of skin eruptions. I mean, which skin eruptions are bad and which are good, and which are in between. So this is not absolute, but just as an indication. Okay? Still going on? You're not happy again. We have break? What about him? He's waiting for a picture. Well, that's all right. Which group is the least disturbing? What's your what's your experience? What's your experience? We have a group of skin disorders, which is quite simple. Now, the simplest, I found that something that can be really cured quite easily is just simple cracks of the skin. Another skin disorder which can be easily cured is ulcers. Ulcers are easily cured and are impressive because even sometimes you have indolent ulcers that are because of a bad circulation. And you apply the homeopathic remedy and you see this deep ulcer disappearing. And then you have these benign growths like condylomata and warts, which is another class of skin eruptions which are easily manageable. And then another class is carbuncles, boils, which are quite, they start to be more difficult to manage. And then acne, mostly in the face and in the back, quite difficult. Then you have the allergic eruptions. You see, the more you go to these categories, the more difficult. And then you have eczema. And then you have neurodermatitis, worse. Herpetic eruptions, psoriasis, lupus erythematosus, And finally, malignant growths like epithelioma and also this Kaposi sarcoma, which appears in the last stages of AIDS. Malignant growths in general, which you are treating really cancer. So we shall be talking in the next hour about these different groups of skin eruptions, and I will give you some indications of how you may be dealing with them. Thank you. We shall be talking about cracks, remedies, or cases where you'll see in the main skin problem, cracking of the skin. The two main remedies that you will be thinking in such cases, when the cracking of the skin is very apparent and very prominent, will be sarsaparilla and petroleum. Also, other remedies that should come to your mind is calcarea carbonica, carbonium sulfuratum, graphites, nitric acid, pulsatilla, sepia, and sulfur. Concerning sulfur, I would like to make a general remark. I would say always look for sulfur and give it with great caution. Sulfur covers every skin eruption that you can imagine, and it may be indicated, but maybe. So be aware of sulfur, because it will come prominent every time, but it is not at every time is indicated. And as a general idea, have in mind that sulfur eruptions usually are accompanied by itching. It's very seldom that you will see a skin eruption that requires sulfur and there is no itching. So I shall be mentioning in my remarks many times, I shall be mentioning sulfur, but you have to be very careful, because sulfur can take care of the local eruption without being really indicated, in which case, most probably in most of the cases, will aggravate the case, will make the skin eruption much bigger without a real amelioration. You see, in homeopathy, you know, when you have an aggravation, it's very good, it's very good, etc. Now with the sulfur, what happens is, usually you say, oh, you have an aggravation, that's very good. And the aggravation comes 1 day, 2 days, 3 days, 2 weeks, 3 weeks, 5 months, nothing happens. That's no good. That means that the remedy was close, but not exact. So sulfur can really aggravate the case without bringing about a cure. And sometimes also you will see taking away a portion of the eruption. It will take away the itching. It will take away some local kind of eruptions. From one locality will take it away, and in another locality will stay. I mean, that kind of reaction, also be aware, is not a curative response. In order to have a curative response with skin eruptions, you will have to have an aggravation which does not last usually more than 1 week. It's very seldom that this aggravation will continue for more than 2 or 3 weeks. And then always, when then there is a curative aggravation, always there is an amelioration on the mental, emotional level, the general state of health, and the general energy. So a good response from a remedy will be accompanied by an amelioration on other levels: energy, general state, mental, emotional state. And when I mention remedies, I will give you a few hints here and there in different eruptions. It does not mean that these are the only remedies that are going to be indicated in such a case. There are other remedies as well, but I mention the most prominent ones. And also, examine your case in its general picture, in his mental emotional picture, and try to fit everything with the case that with the remedy that you are deciding. Don't just go and give. Sometimes there are some good results by using one keynote. For instance, using petroleum for cracks, but petroleum will not do the case. Cracks, for instance, that are come only during winter. If the cracks are coming only during, sarsaparilla goes away. You see, I told you sarsaparilla is the main remedy for cracks, but it has constant deep cracks, constant cracks, especially where? In the feet. The cracks of sarsaparilla are in the feet, mostly. Petroleum, it can be anywhere. Now, if that is worse in winter, the cracks, then becomes petroleum more, definitely, and also calcarea carbonica, because of the aggravation from cold. Also, sepia comes now into picture, and carbonium sulfuratum also. If the cracks are very painful, sarsaparilla comes into picture again, with petroleum second, and then nitric acid comes into the picture. If the cracks are in the heel of the foot, what are the remedy? It's one remedy. It's very prominent, right? It's lycopodium. Lycopodium, and also another remedy which is not in the repertoire is calcarea fluorica. Calcarea fluorica. But if the cracks are on the tips, or are here on the tips of the fingers, the remedy that is the number one remedy that you will be thinking is graphitis. But if the cracks are general in the hand, fingers in general, and hand, then again petroleum, calcarea carbonica, and sarsaparilla. But if you have a case where the cracks are mostly on the bends of the elbows and the back of the knee, the remedy is, we had such a case in Belgium, the remedy is in the bend of joints, graphitis. Very good. In ulcers in general, I'll give you a few general pictures, like arsenicum. It's very good remedy. Anthracinum is another one. Carbo vegetabilis, also, due to best circulation. Hepar sulfur. Kali sulfuricum and kali bichromicum. Lachesis, mercury, nitric acid, phytolaca, mercury, nitric acid, phytolaca, pulsatilla, silica, sulfur again. But if the ulcer is blackish, it has a black color. The color goes towards black. What is the main remedy? Anthracinum. Anthracinum. Carbovegetabilis also can be there, and also lachesis. But if this blackish color is all around the ulcer, the blackish color is all around, then it becomes mostly lachesis. And of course the bluish red color belongs to lachesis and also arsenicum and silica. If these ulcers are burning, usually the pain is burning, but when it's excessively burning, it's like fire really, then the main remedies are Anthracinum arsenicum and Tarantula cubensis. You see, I give you mostly my experience. I don't give you all the remedies that are in the repertory, etc. Then you will find a lot of other remedies as well. Now, every eruption that will be ameliorated by cold application, cold water, cold application, any eruption, in ulcers, will be mostly ledum and pulsatilla. When the discharge also, the color of the discharge, it can become important, especially if there are peculiar colors like black discharge, blackish discharge. We have Anthracinum, sulfur, lycopodium, sometimes bryonia. Where the discharge is of grayish color, grayish discharge is one remedy which is very important, is causticum. Gray. In green discharge we have arsenicum, natrium sulfuricum, main remedies. Discharge which smells like old cheese is one remedy, heparsulfur, right? And when the discharge is sourish smelling, sour, which are the remedies that smell sour very much? Calcarea, heparsulfur, right? And in this particular case, mercury also can be indicated. You see, when you have boils, carbuncles, boils that come repeatedly in the history of a patient, you have boils breaking out and again, and they retreat, they break again, and there is a history of boils in general. The remedies that you will be thinking is heparsulfur and sulfur. Main remedies. Also calcarea sulfurica. Bromium, mercury, calcarea carbonica, bromium, mercury, calcarea carbonica as well. Boils that are enormous in size. And of a texture which is You see, you palpate the boil, and the boil is quite full, and movable within the structure. The muscular structure is movable, but absolutely is not diffused there. It's a mass. It's a hard mass with burning pain, excessively burning pain. It's anthracinum. Well, we don't know the remedy. Anthracinum is not well known. And I have a case. John, can you show this case? I have a case. I just treated a case in one of the cases in the United States. You will see on video. Do you see it? This seems to be quite deep, and there's a hard mass. Very painful, eh?
Mm-hmm.
You don't scream.
When you scream, no. I don't scream.
Better earlier in the day.
About this size. Quite deep, about 3 centimeters deep.
She may scream by this evening.
Oh, the evening becomes
It gets worse. Where's
yes.
it then?
So, when did she develop this?
Well, she's had a sebaceous cyst in that place for about 8 years.
Yes. See, there is
About 9 days ago.
what you see there is for 8 years. For 8 years. So here's this tremendous boil. It's about that size. Inside, when I palpate, it goes, it's open. For 8 years. And did you see the color? The color now, it's not blackish, but it's towards that. It's going towards that color, right? Now what happened is that he squeezed it and aggravated and created a lot of pain eventually. And that's why he brings the case. He's an American practitioner, this is his wife, and he brought the case because of tremendous pain. The woman cannot sleep because of tremendous pain, burning pain. And we are called now to treat this boil, right? Now, in such a case, if you do not find the remedy, what might happen is a little bit you ameliorate the pain. You see, she will say the pain was, you give sulfur. You can give sulfur in this case, or you can give lachesis. What she will say is that the pain for 1 or 2 days was less, and then came back. Then you give sulfur. The pain, yes, a little bit less, maybe less this, less that, but nothing substantial, really. Nothing substantial. The thing is, it's not something that came yesterday or a month ago. It's 8 years. Did you find the follow-up? Because I think the first you saw it was the follow-up. You see, what happened is, anyhow, with this case, I stayed in the United States for 5 weeks. Now, this case, I have seen it, say, the second week. So there are several follow-ups, 2 days later on, 7 days later on, by her husband. He gives the follow-up, and eventually She comes herself after about 3 weeks, 18 days or 20 days. And of 7 days, but not the final. After lunch, he was. You see, it's a pity, because I would like, and I hope he will find the 3-week follow-up, and you will see where this boy lives. But let us hear a little bit the story, because through this story you are learning a new remedy, Anthracinum. Let us hear a bit this story. On the video.
And I squeezed out quite a bit of offensive-smelling white sebaceous matter afterwards. And
what smell?
It smelled like very strong cheese, offensive.
You see, it smells like strong cheese, right? Listen now, why I did not give hepatic sulfur? You see, this is the smell of hepatic sulfur. Why not giving hepatic sulfur? It's very important. And also the fact that it smells very badly, it shows perhaps a process which is quite severe. Let's see a little bit more.
And
what smell?
It smelled like very strong cheese, offensive. But from what I've seen of other sebaceous cysts, it was exactly the same smell. And then the next day again, it was still, always there would be something oozing, so I squeezed it and expressed it again, till it became about 30% the size of what it ordinarily is. This is roughly the size that it ordinarily is. It's been there.
Bulging out like that?
Yes, yes.
All the time?
Yes.
For the last 8 years?
Yes.
Oh, I see. I see. And this redness was always there?
No, never.
Never discoloration, never pain.
I see.
Here's what happened.
Now there is an inflammation.
Yes, very much.
Yes.
So it was painful the second day after I did it. It was painful, so we decided to leave it alone. But it was markedly smaller. I could feel all of the contents of the cyst. Then we didn't touch it, and slowly over the next 3 days, she wasn't feeling as well. Not in regard to the cyst.
It was still oozing, though. All this time it would ooze by itself.
A serosanguinous discharge came at the end, a reddish tinged discharge.
Yeah.
And then what happened was, by Wednesday morning, she was having a headache, she couldn't make any decisions, she was dying for open air, and had the feeling, she said, that she wanted to go outside without her clothes on in the cold. Yeah. Constantly wanting to
At 7 in the morning, when it was real cold and it felt, the cold would feel great. Stomach ache, wanting to cry.
Emotional. Yeah. So I gave a dose of pulsatilla, 1 pulsatilla.
Now what this case will be teaching us eventually, it will be that Anthracinum, in its mental picture, is quite like pulsatilla. That's one lesson. Quite like pulsatilla. What is pulsatilla? Wants to cry, wants window opens. But she will feel more the cold. Now, in the reaction she was having, eventually, you will see other symptoms coming up, which are very interesting and which look like symptoms of natrum muriaticum. Let's see a little bit more. But you see the dullness of the mind, the difficulty to make decisions. A little bit more.
It would feel great. Stomach ache, wanting to cry.
Emotional.
Yeah.
So I gave a dose of pulsatilla 1M. Pulsatilla has done good work in the past for her.
Yes.
And within a half hour, she was...
All better. I didn't have the headache or the stomach ache or I wasn't hot. I wasn't emotionally distressed.
Now another lesson we have to learn. What he says is pulsatilla has been working for her all these years. He was giving pulsatilla and something was happening. I mean, she was feeling better every time. Which shows that we can really bring about some kind of amelioration with a remedy which is similar but not dissimilimum, as the exact remedy that we need to give. And why this case was treated for 10 years with homeopathy and no real big changes, deep changes, but still she can keep on with her life because we don't know enough of the picture of Anthracinum. Now the mass, the hard mass, the huge mass, the picture of pulsatilla, the desire open air, the headaches that are associated with this, and also the indecision come to form a picture of another remedy. And you will see other symptoms as well. Just show a little bit more.
She was...
All better. I didn't have the headache or the stomach ache or I wasn't hot. I wasn't emotionally distressed.
But then...
This stopped draining.
It stopped draining.
Started getting red, painful, hot.
Searing hot. Yeah.
Searing.
I mean,
what is searing?
It reminds me of branding an animal. You know, they heat an iron. And,
heat, burning.
Yeah.
Do you see, did you hear the intensity? She says she feels like being in a fire, like an animal. Like the animals, they stamp on to make a mark on the animal. They have a seal burning, and she feels that feeling. You see the intensity with which they describe both, they describe the pain. Now the intensity of the pain, it will become also characteristic in this case, in order to decide one remedy or another. Well, if she was hypersulfur, would she say desire open air? No. Hypersulfur likes to be warm. The burning pain, is it characteristic of hypersulfur? Not so much. It's arsenicum. It's anthracinum, but not so much hypersulfur. So it was a difficult case. I mean, don't think that this case is easy. George saw the case and gave us anthracinum. No, it took a long process of thinking before I concluded on this remedy. But because the remedy was correct, you will see the effect, actually. Let's see a little bit more.
No, they heat an iron. And,
heat, burning.
Yeah. It's been getting progressively, it's wearing her down. She's not sleeping well. Anybody touches it, she moves.
Do you feel cold now?
No.
No, still feel warm.
Warm.
She feels well, actually, in all other ways.
In all other ways?
Emotionally, I feel much better than I did when this was draining.
Yes.
But this hurts a lot. By evening, it hurts all the way up into my head and down in here.
In the evening, especially.
And then when I lay down for the night, it feels the best. Not right away, but when I've been down for hours, then it feels the best.
Although the sleep is not really good.
I wake up a lot.
I see. Any other symptom?
No, just that it's always hot and burning. it comes in waves, or sometimes it feels real hot and then that'll dissipate for a while and it'll just ache.
She says it comes in waves. That points out to another remedy, which is pain comes in waves, and with this kind of color, this color which is bluish black and bluish red, the remedy is lachesis. Lachesis. Yes? A little bit more?
No, just that it's always hot and burning. It comes in waves, or sometimes it feels real hot and then that'll dissipate for a while and it'll just ache.
That's what I was thinking.
Yeah. Do you have any anemia?
Mm-hmm.
You are anemic.
Well, she's pregnant.
Oh, she's pregnant now.
She's in her...
She's always anemic?
No.
No. Now she's
But always low iron compared to what most people.
low iron. I see. That's what you have been told.
But actually, this is her third pregnancy and it's her best pregnancy, by far.
Yes.
With good homeopathic treatment, I
Yes.
think. And
So I did go to India recently, come back with hepatitis, not yellow eyes, but itching all over, slightly elevated liver enzymes.
Itching all over.
terrible.
Terrible itching.
At night.
You gave Vithoulkas?
Mm-hmm.
You gave Vithoulkas?
The next day I was 80% better.
Yeah. Vithoulkas. He got his wife well after the lecture, yeah.
And she has had no remedy between Dolisos and the pulsatilla this month.
Pulsatilla, I see.
That was 2 months ago.
Yeah.
A little bit more than 2
Yes.
months.
Yes.
And the anemia, as far as that goes, she was more anemic in past pregnancies. Her hematocrit is 34 right now. She would be around 29 or 30 even in prior pregnancies. So for her, it's probably reasonable.
Right. All right.
Thank you.
Can you push the do you have the analysis? Yes. No. Right, okay. So anyhow, there was a discussion in the class, and I would like you to show you the discussion that took place. And I decided on Anthracinum. Do you have the first follow-up? Is her husband talking about the case 2 days later, after Anthracinum? What is interesting also is with pulsatilla, she says it stopped discharging, but the pain was much greater. When she came there, the pain was really excruciating. The husband came and told me she's very patient. She can stand a lot of pain, and because she is not shouting, do not think she's not in very great pain. She's in very great pain. Yeah, that is now the follow-up, I think 2 days later. Let us see.
Got the remedy at 2 o'clock in the afternoon. 200. Anthracinum 200. And she felt dizzy very soon after she took the remedy and thought that she was about to get a headache. And the affected area became very, very hot after the remedy, both inside and out. And she felt lots of downward vaginal pressure and Braxton Hicks contractions when she was walking around. And that's persisted pretty much, although it's let up today. 1 hour after she took it, she went to sit in a park, and she said she had more peaceful concentration than in days. So she realized something wasn't right. Though she said she didn't realize she had lost that until the sense of peace returned. By 2.5 hours after the remedy, she was exhausted, but she had more pain-free movement of her neck.
She had more
pain-free movement.
pain-free.
By 7 in the evening, 5 hours after the remedy, the muscles that were very painfully involved with the ulcer were much better. And she had an all-pervading feeling of peace and sleepiness, lots of yawning. She said, "I'm a walking zombie." Where the previous night at the same time, she was at her worst with pain and restlessness. She said, "I feel like I'll sleep forever." The first night in days, she'd looked forward to the nighttime because she had had very bad nights. And she was confident that she would have a restful sleep. And she had a pretty good sleep, definitely improved sleep. Then on the next day, there was definite improvement in the sense of the pain being lessened. But you couldn't really see anything different. Now yesterday, the cyst got more massive. It spread out. It wasn't as raised, but it involved more area actually, especially spreading out, extending to the neck. And it was tighter and hotter and more painful again, though not like before the remedy. It was worse than the preceding day. And she experienced stinging and throbbing pain, but not that searing burning that she'd had. And then today, it was down in size, and I should mention yesterday, because you had mentioned lachesis, yesterday it was purple, and she didn't want it touched at all, and she didn't like anything, and she was holding up her clothes. And then today, it was down in size, softer, more fluctuant, and off and on it began exuding small amounts of that same foul, infected-smelling discharge, just since today, somewhat. It's hotter and more painful while she's up and moving, and definitely better when she's reclining or even sitting. She had some transient headaches today, but it's much less painful than yesterday, still. I had given some follow-up on Wednesday.
Yeah. So this actually is the 4th day that he talks about the case and talks about everyday progress. And he says some interesting things. First of all, that what is interesting to hear in this case is that she became sleepy. Sleepiness after a remedy, desire to sleep and to sleep for days perhaps, is a good sign, and you have to understand that this really shows that the remedy is acting deeply. Another point that it was good is the sense of peace that she felt. She had a sense of peace inside her, and also you see that the actual mass becomes bigger. You said, don't worry about that, as long as the other signs are present. You see, the actual size became bigger. That's no problem, as long as there is a sense of peace, there is sleepiness, there is a sense of well-being, whatever it is, or mental, emotional amelioration. And you see, the first days, she needs, a regression of the tumor eventually. Either of the two can be followed, and as long the general state of the patient is getting better in general, both of these actions are acceptable. In this case, it followed the first course. Let's see now what he says 7 days later.
On Wednesday, 4 days ago, 3 days after the remedy was given, and just
For
so
how long it was there, the cyst? For how long?
8 years.
8 years.
Just so we don't do an American case here, she's much better. Much better. Really, incredibly better. In fact, today, every day better, with a little bit ups and downs, but today she's doing exceedingly well. Yesterday it opened up.
Yesterday it opened up?
Yeah. Friday she felt, actually to give a little more evolution, after the remedy the pain went down dramatically.
Yeah.
And there were immediate effects that were felt, almost from immediately after the remedy was given. But to be brief, the actual thing became larger after the remedy. Even though the pain went away, it became really large. I mean, it was 5 or 6 inches across. And people would look at it and just be in disbelief. But she was uncomfortable in comparison with when...
It's very, very strange. You see the bulge, the becomes, I mean, the size is bigger, but the actual pain is reducing.
Reduced 75, 80% at that point. And then what happened was, by Friday, 2 days ago, there were a lot of sensations, prickly sensations, not that hot burning that was there, but prickly sensations and a lot of pressure. And you could see on certain points where it was beginning to get ripe in different areas, where little whitish areas were forming, and you could see underneath the pus that would later discharge. And yesterday, after she got out of the bathtub, even unknowing to her, it was starting to discharge, and maybe she lost a teaspoon or a teaspoon and a half of pus. And today, maybe a tablespoon. And it's way down. It's still quite large, but it's way down compared to what it was. There's no pain whatsoever, or very mild, if to speak of. And the skin coloration, the normal coloration, is starting to come in around the edges. She has some interesting, she's be a good prover. She always does this with remedies. There's a bunch of little proving symptoms, and all of which are very strongly represented in herring for Anthracinum. She had some dizziness all through the week, off and on, light headaches early in the day, and when the headaches would go away, she'd, in the afternoon, feel very indisposed to work. And that's strong for Anthracinum, actually, and she's, if anything more, a workaholic type. And then she gets restless at night, and it abates around 3 in the morning, and she sleeps better. Her appetite has been decreased all week long, and she's lost a couple of pounds, but overall she's feeling very well.
Great.
That must be, you don't have any more follow-ups. That must be the 7th day, I think. This follow-up is the 7th day already has started discharging. It discharged for another 10 days. It discharged quite a lot of matter. In the beginning, the matter was offensive. Eventually, there was no smell from the discharge. Was discharged without smell. But the most important thing is that this lady had a tremendous amelioration. If he can find the follow-ups. There are some more follow-ups, I think, paper follow-ups, if you search somewhere. Must be given, except of the one, except of this one. But anyhow, I hope you will find the the final one, because it's very impressive. You will see no more. This is completely gone. But this is not important. What is important is that this woman had gone through grief 18 years ago. 18 years ago or 15 years ago, well, long years ago, had gone through grief. And because of that grief and after that grief, she was never able to have her feelings back. Her feelings were cut off in a big way, in a big manner. She was not able to really enjoy life. And not only that, but she had not exactly an aversion to sex, but she had really not enjoyed sex ever since that incident where she had that big grief. Now, Natrium muriaticum was given, pulsatilla was given, and several other remedies were given without ever touching the case. After Anthracinum, she felt everything was coming back, and for several days she was crying. She was crying and crying and crying and crying, and she would have pictures of the past coming back. It's a pity we don't have this follow-up. Picture of the past will come up with grief, and she would cry. And then her husband telephoned me. She said she is crying all the time. She wants the window open, etc. And what shall I do? I said, console her. Console her, you know. Just to say, he said, that's very strange, because yesterday I was in the class. He was coming in the class, and her wife is in the house, and she was crying so much. Then he telephoned her and tried to talk to her. And after talking to her, he said, I was a little bit upset. In the night I would go back to the house to see how she was, because I felt she was really bad, crying all the time. He says, I was amazed to hear her saying in the night when I went back to, he had spoken in the noontime, right, in the middle of the course. And then in the night the course is finished, we went back home. He said, I was amazed to hear that she said that after talking to me, consoling me, I was better, I was much better. So in this case, now you will think that now this is a case of pulsatilla, and you go and prescribe pulsatilla. No, this is wrong. It's wrong. When you see all this upheaval happening inside the patient, wait, and you will see miracles. If you give pulsatilla in order to stop her crying, you may spoil the case. In this case, I doubt if one dose of pulsatilla would have spoiled really the case, but you may spoil the case. Now she went on for crying for about 7 or 8 days. 7 or 8 days she cried and cried and cried, exactly the way that pulsatilla does. And pulsatilla was helping this case, according to her husband, but never touching the case in a deeper level. What was interesting is that what I have been teaching all these years, that sometimes it does this work. Do not switch off. Well, in my teaching several times I have said automatic everything here, that you have a case with different layers, that's very interesting. It's a phenomenon which I have seen many times. Now here we have Anthracinum, maybe pulsatilla, silica, calcarea carbonica. This actually is the real state of the patient. That means the patient will need first Anthracinum, then pulsatilla, then silica, then calcarea carbonica in the course of, say, 2 years or 3 years before this person is really cured. Now, you never discover Anthracinum, because it's a small remedy, it's a difficult remedy, your mind does not go, and you prescribe different other remedies. That is, every time she has something severe, or a cold, or a common, or something indisposition or a general symptomatology or acute symptomatology, chronic. A picture is here formed. The one time is pulsatilla, the other time is lachesis, the third time is gelsemium. And every time you give the remedy, and this goes away, doesn't go away now. This layer, upon the layers, it goes away with a particular remedy, and you have the impression that the person, what he says is absolutely sincere. He feels that this woman had good homeopathic treatment because every time she was treated successfully. I had this and I was treated, and I had that and I had treated, and I had the other thing and I was treated. But the actual unraveling, peeling off of layers had never started. It is now with Anthracinum that he has the first deep remedy that takes away the first layer, really. Everything else happens upon that layer. It was taken care. This woman could have, upon that chronic state, could have a lumbago, rastox. The lumbago goes away. He had a headache, pulsatilla. Pulsatilla takes the headache away. He has a common cold, gelsemium. Gelsemium takes away. Everything happens from Anthracinum upwards, but never from Anthracinum downwards. Now, once you see this kind of deep reaction, don't be in a hurry to give a remedy. I mean, you would be surprised the way that he described the case, how close it was to pulsatilla. Everybody will say, well, she's crying so much, she's suffering so much. Why don't you give a pulsatilla to relieve her? Wrong. You should never give pulsatilla in this case. Console her, yes, you can give all these measures, but not give a remedy. The case I mean, as it progresses, the energy was strong, the mental clarity became very acute. She never had that clarity before. The emotions became alive. The sexual sphere was opened. She says, I am enjoying life as I have never enjoyed before. That is the action that you expect from the right, what we call constitutional remedy. I mean, whatever you call it. Here it's a confusion of terms, because now here in this case, let us say that this person really needs Anthracinum, pulsatilla, silica, and calcarea, which can be said to be a constitutional remedy out of the four. But we call it a constitutional remedy once it affects the whole organism and takes away a layer. The next time that we shall have a pulsatilla situation, and pulsatilla will go deeper, then we can also say that we are treating this person constitutionally. It happens sometimes that a person from the beginning of his life till the end of his life will need one remedy, will be a calcarea carbonica case. Every time he has a relapse, it goes to calcarea carbonica. But these cases are very few. Usually the cases are of that type. Our generation is too ill, too sick to be treated with one remedy. One remedy on a whole life of a person means that the person is really very healthy. And are the cases where you treat and you are very happy, you are very satisfied, your patient is satisfied, yourself you are satisfied, you say you are God, you made a miraculous thing like that. It doesn't happen every time. It doesn't happen every day. Boils, carbuncles, and this kind of skin eruptions are still not very difficult to manage. not very difficult to handle. And usually they have a good prognosis and they have good reactions. There is another type of this disorder which is a generalized state of carbuncles. It's called a hidradenitis. It usually appears in the axilla and on the inguinal region, and usually eventually it progresses, it occupies the whole body, disfigures the body, and especially the face becomes completely disfigured, the nose, etc. And this is a state which looks like carbuncles or boils, but actually it's a much more serious condition, and it's not easily manageable by homeopathy. Though we can have definitely quite a lot of success with this disease, we may see long periods of aggravations. In this disease, you may start in a case and you may give up very soon because of the exacerbation of the aggravation which takes place. And unless you persist for several years, you are not going to see real results in such cases. This disease, as I said, is called hidradenitis, and it looks like boils or carbuncles, but it is not. It's a much deeper state of disorders. In this case, we have keloids. You know, there are it's like smallpox. Every boil leaves a mark, and many times the marks are keloids, much stronger. Therefore, we have remedies like graphitis, of course, and silica, calcarea sulfurica, calcarea carbonica, which can be indicated, but I have found also in this type of cases they need a series of remedies. It's not one remedy that will do it. It's a series of remedies, and I have found, is my experience in such cases of hidradenitis, that there is a lot of emotional problems. Usually a woman, and usually they are loaded with emotions which were never expressed, very strong emotions that they were never expressed, and it seems that the body expresses this kind of emotions through these upheavals, through these boils that can become tremendously big and can disfigure the whole face. I mean, you can see a boil bulging out from here, from there, and eventually when it will go down, you will have a bigger or a smaller mark. Yes, I mean that they will need to be treated on several layers. The first remedy, the second remedy, the third remedy, the fourth remedy, and after 2-3 years of treating such cases, you may really notice some changes coming about. Once you treat them successfully in the beginning, you will have a big aggravation. We don't see these aggravations with common boils or recurrent carbuncles and boils, which in other cases it's quite easy to handle. And we now come to eczema, which is eczema is one of the most common skin eruptions that you will be treating, and here the successes will become less because at this moment the general state of health is not strong enough to give you a clear picture of the remedy, and eczematous cases, they do not give out a clear picture. And you have, in these cases, actually you have definitely to take into consideration general mental, emotional symptoms before you can find the remedy. And also it is my experience in treating cases that have been treated before by other homeopaths. It's my experience that that eczema, after being treated for many years with homeopathy, can in a way be suppressed in one way or another. I'm going to show you a case on video again of a child with eczema that the eczema was treated and he developed some chest problems, some asthma, and then eventually he developed some personality disorders, and I will show you how the disease went inside and how the disease will come outside during treatment. Remedies for the eczema. Now here we have to mention first sulfur. Sulfur is the #1 remedy that will be covering about 20-25% of the cases of eczema. Other remedy which is very prominently indicated, and I have severe kinds of eczema, especially in the face, especially around the eyes, the eyebrows, is meserium. Of course, again, remedies like graphitis and sepia. Sepia actually is one of the best skin remedies, and it will be indicated in many conditions. Eczema will be treated with dulcamara also. Dulcamara many times will be indicated, especially if the eczema or the condition has come after an exposure to cold wet. The same with rustox. Again, arsenicum, arsenicum iodine, calcarea, calcarea sulfurica, hypersulfur, and both juglans, juglans cinerea and juglans regia. Juglans cinerea and juglans regia. Oleander, petroleum, psurinum, but here again you have to individualize, and you will go to the repertory. You will have to work with the repertory. You have, I don't know how many of you are working with the repertory, but I don't believe that anybody can have in his mind the information which is given in our materia medicas. Therefore, it's necessary, it's absolutely necessary to use the repertory. So, going into the repertory, you will see a lot of modifications of these remedies, and will give you a lot of information. I'm just giving you highlights now. What is of my experience? What remedies will come mostly prominent in such cases? I forgot, I think in carbuncles, did I speak about remedies? In carbuncles, I forgot to give you another remedy which is very important. It's Tarantula cubensis. Tarantula cubensis. Did I speak about Tarantula cubensis? Carbuncles that are burning, that are discharging but still are very much painful, burning. Tarantula cubensis will be together with Anthracinum. I mean, on the same par. And then Arsenicum, and then Crotalus cascavella, and Apis, and things that are like that, and then Lachesis, of course, will be indicated. And we'll have remedies also that they have a predisposition to alternate between skin eruptions and internal disorders. Mostly, if you see a duodenal ulcer state alternating with skin eruptions, or if you see immediately a relationship between a suppressed skin eruption and the almost immediate appearance of a duodenal ulcer within 2-3 months after the eruption was gone, a duodenal ulcer appeared. That is a keynote of graphitis. You can be almost certain that the remedy will be graphitis. Another characteristic of graphitis is when usually graphitis has discharge, has a wet eczema with a lot of discharge, and the discharge is sticky. It's like honey. They describe it as honey. Sticky and yellowish color. Yellowish brown, yellowish color. Wet eczema also you will find in Lycopodium, in Dulcamara. Creosotum also is a remedy. And of course, sulfur. But if the discharge is very thin, like watery discharge, then the remedies will be Crotalus horridus or Tarantula cubensis again. If the discharge is from the eczema, everything that comes out is yellowish. It is ras venenata. Ras venenata. Like ras tox and ras venenata. So, also cuprum has this yellow discharge. Cuprum. What is ras tox and ras venenata? Both, they have a peculiarity where the itching, which both these remedies produce very intensely, the itching is ameliorated if they put the part which is itching in very hot water. Very hot water, boiling almost water. They just bear it. They can just bear the heat. They put it inside. That is the only time when they get an amelioration. This is a characteristic of ras tox or ras venenata. Arsenicum also is better. Warm applications. Oleander, the characteristic of oleander is that the eczema appears mostly on the top of the head, and the eczema is mostly in children or in babies. Another characteristic is also that there are thick crusts, very thick crusts, under which if you lift them, then there is oozing. wherever. And then we have allergic reactions, allergic conditions, which some remedies produce. And if we have a generalized rash, red rash, as an allergic condition, the first remedies that we will be thinking is pulsatilla, apis, chloralum, belladonna, vespa, and rustox. Of course, sulfur always is there. Even if I don't mention sulfur, sulfur is there. There is another remedy in urticaria, generalized urticaria, where especially the urticaria is a small red bumps, little bumps, full of little bumps raised and becomes red. Whole areas of little bumps raised of an allergic type of an eruption with intense itching. There is a remedy which you have to think is astacus. Astacus. You know astacus? You know what it is? Lobster. Lobster. You have seen lobster, the color of lobster, more or less that type of appearance in small spots, raised small spots, generalized state. Astacus fluviatilis. If the urticaria affects mostly the extremities, then chloralum becomes very important, Crotalus cascavella, Medorinum, Copaiva, Lachesis, and Apis, Copaiva. These remedies become important. With the most terrifying of these are the Crotalus cascavella, where the urticaria can take enormous enormous patches that become very raised, very red, and really looking fiery red, very raised in big patches. You will see the thigh, almost the whole thigh is swollen in a place. Crotalus cascavella. Crotalus cascavella, of course, has a mental picture that goes with it, a lot of fears, a lot of delusions almost with fears. But it's not the time here. We cannot give all the information about all these remedies. I'm just giving you indications. If, for instance, an urticaria or an allergic reaction comes mostly in the night, then we have apis as the main remedy. Apis. Bovista. Bovista is a remedy that has an interesting condition in allergic reaction where the itching is so tremendous that the person has to scratch, and there is a tremendous anxiety in this person, and the person is very in a great state of anxiety and excitement at the same time. Tremendous anxiety, tremendous excitement, and this itching comes, and the body comes out, breaks out with this eruption, and they scratch and bleeds and creates little wounds. And the whole body, all the time, all the body from scratching looks little wounds all over the places. Now, Babista also has another characteristic, which is a kind of awkwardness. They become very awkward. People, they want to take this, and before they take this, they throw this one, they throw that one, and then they catch this. I mean, there's an awkwardness. They don't direct their extremities very much. If you have a case of, say, asthma alternating with skin eruptions of an allergic type, an allergic asthma with a kind of urticaria alternating. When the urticaria is out, the asthma is better. When the asthma is on, the urticaria is not there. Then we have apis again, and caladium, and possibly graphitis. And urticaria, which comes every time a person takes a bath, is mostly lachesis, and urtica urines as well, and phosphorus. An allergic reaction that comes in cold air. As soon as the person gets cold, the reaction starts. Then we have what remedy? Rastox again. Nitric acid, the possibility of nitric acid or sepia. A better amelioration with cold air will be dolichos and calibichromicum, and sometimes calcarea carbonica. But an eruption or a skin allergic condition that comes after cold and wet, mostly dulcamara, possibly calcarea phosphorica, calcarea carbonica. An allergic reaction that comes after exertion. As soon as they exert themselves, they produce a reaction. Is mostly conium, mercury, natrum muriaticum, psorinum, urtica urens. Conium, mercury, natrum muriaticum, psorinum, and urtica urens. Antimonium crudum has a reaction to meat. People allergic to meat in general, we have been thinking of antimonium crudum with a desire for, which is the main desire for antimonium crudum is cucumber. Excessive desire, inordinate desire for cucumber, and allergic reaction to meat. We have allergic conditions that come before menses. Again, natrum muriaticum, which is very well known for a reaction before menses, calicarbonicum and dulcamara. If you happen to have a case where there is nausea preceding the skin eruption, there is nausea or vomiting, and then the skin eruption breaks out, then the remedy is sanguinaria. Now this type of allergic conditions, you may be finding some of the cases are very stubborn, and you may be battling for years before you can really bring them around. They are not easy cases to manage, but don't forget, I don't remember if I mentioned, the Anthracinum is one of the best remedies for this kind of allergic conditions, where we have the swelling of the area which is inflamed. And of course, better in the sea will be a keynote. In this condition, in urticaria, I will think that remedies like apis, most frequently indicated, apis, Anthracinum, Dulcamara, Urtica urens, and Pulsatilla. I would say these are the most frequently indicated remedies. In what potency? What? The potency, you see, as long as you find the remedy, the potency always is going to act, whether you give 6x, 12, 30, 200, or 1m or 10m. One observation concerning potencies also, I would say in skin eruptions, you do not have to go very high. 200 is a good, very good potency to work with skin eruptions. 30 also, you can start with 30 and find out, because some allergic people are so sensitive that they may have big reactions. So it's good if you see somebody who is sensitive. And do you understand what I mean, sensitive persons? You see these people that are quite highly strung, nervous, anxious, hysterical type of people, with a skin which you see is not a healthy skin, and every time they get excited, they bring out a reaction. Natrum muriaticum or mercury will be this type of people. Now, don't go too high. 30 is okay. 200 is the best for my understanding, to my understanding. Now, what I have observed, I must tell you some experiences that I have been having. And I have these experiences. Why? Because since I tried to teach publicly, and of course I had an experience of the Athenian Center, right? And I brought this experience to the public and said, more or less, this is what happens. But in Athens, I never obliged every patient that I have seen to come back to see me and see what happened. Therefore, the statistics which I had in my mind were only what I perceived from people coming back. There was a big percentage of people that they never came back, and I did not know what happened with them. And I was giving some kind of statistics when they will ask me in public what homeopathy can do. And the statistics, my statistics will be from 60%, and I will take it up to 85%. Sometimes, in some cases, we have up to 85%. I don't think I ever said more than 85%. Now, what happened is that, and I did not know that, since the students wanted to see the cases and wanted to see now, I would like to see this 85% or 75%, whatever you claim. I would like to see it. So I was obliged to take cases on video in front of the class, and I treated. And in the beginning, I treated the case, and I left the case, and I said, okay, next year we'll see what happens. And the feedback that I was getting from next year, from 1 year later, it was usually, well, it didn't work, or it worked for a few days, blah, 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 and all these things. I said, wait a moment. That's not what I know that homeopathy can do. So, from last year, I decided that I'm going to see every case that I see. I will have to see it on video. For instance, in America, I made every case that I have seen to come back, even if it was after a few days, to evaluate whether the remedy is acting or not. And it was during that time that I discovered certain things, because you don't know unless you have these close follow-ups. The things I discovered was, for instance, there was a case of acute otitis media. They brought the child, and it was for me a perfect Camomilla case. So I said, okay, give Camomilla 10 m. The child took Camomilla 10 m, and I would like to see the child in 2 days, because the child was in pain, and the practitioners were a bit anxious to see what happens with the child, etc. So in 2 days I see the child, and the child was a kind of better, yes, but not the kind of response that you expect from 10 m. So I said, okay, it seems that it works, but it works too lightly. I mean, this is not a response from a 10 m, but let us wait 1 more day or 2 more days, and in case that there is a kind of relapse, then give 200. I mean, 10 m, 10,000 with 200, it's a big difference, right? The 10 m must be at least 20 times stronger than the 200. So from 10 m, I said we'll go down to 200, because 200 seems to be better, at least from a pharmacy which comes from the United States. They have potentized the 200, and I'm sure about this 200. And I said, okay, in case the child has a relapse, give 200. They gave a relapse, and it is on video, and you will see it if you want it. 4 days later, they gave, because the child was relapsing. That's not a reaction from a 10 m. They gave 200, and after 200, the child really did well. I had another case, was presented to me, a case of severe, very severe cystitis with bronchitis at the same time. And it was given Cantharis 30. It had a relapse, and after the relapse, it was given 200, and nothing happened. The Cantharis 30 worked for 2 days, then a relapse, 200, nothing happened. They brought the case back, and the case looked like Cantharis still, but 200 was not working. I said, okay, give again 30 from the original 30, repeated doses, and the case did very well. Now what happened? The 200 was not potentized. Unfortunately, at this stage we do not have a means of checking the remedy. Actually, by the way, somebody, I don't know if he is here, last year told me that there is a woman here in Holland who can tell whether a remedy is potentized or not. I said, gosh, we hire this woman anytime for any price, as long as she can prove that claim. And I proposed an experiment, actually, where I will give her 20 vials, and these 20 vials, 3 of them will have real medicine. and I will put the medicine in 3 vials. I will write the number and I will seal it on an envelope, and will be here. And I proposed to her to come actually here in front of everybody. It's very interesting. And she will go through the vials, and if she finds the 3 vials, everybody will pay 2 guilders to her. And then we'll hire her for good. I mean, checking the remedy. And there's no question about it. If we can find such a machine, even if it's a human machine, that can do that, we are very much interested. So I made the proposal. I don't know if the proposal will come through, and I hear that there have been somebody is saying is proposing that to her. But what is interesting for us to know is that when you give a remedy and you are sure about the remedy, don't change because it has not acted. Don't change the remedy, change the pharmacy. Herpes, in general, herpes zoster, herpes zoster is ranunculus bulbosus, and rastox, variolinum also, one of the main remedies, and thuya. Possibilities: mercury, lachesis, arsenicum, graphitis. Now, if the herpes, they have a periodicity. Mostly it's arsenicum. Possibility of mercury and Vithoulkas. Vithoulkas. Now, if you have cancerous affections of the skin, like epithelioma, hydrastis is an interesting remedy. Conium, calysulfuricum, lycopodium, arsenicum iodine. For melanoma, we have lachesis, again conium, crotalus horridus, argentum nitricum, lachesis, conium, crotalus horridus, argentum nitricum, caliphosphoricum, calcarea carbonica, arsenicum, mercury, sulfur. If you go to lupus erythematodus, nitric acid thuya, main remedies, hydrocotyle also, lycopodium hydrocotyle, lycopodium, sepia, Vithoulkas, arsenicum, calichloricum. For vitiligo, especially in the children, you will not cure vitiligo. I mean, all this, as we go further to more serious condition, we have less and less successes with the homeopathic remedy. In vitiligo, for instance, I have seen 2 cases cured. And I have seen, usually you don't see for vitiligo, but on the side, you see the progress of vitiligo and you see whether you are curing or not. Vitiligo, which is spread already 5 years, 10 years, 15 years, very little. It can regress, but very little. Now, in children, it's another story because you get it very early. The child is reacting easily, and I find their sepia is one of the main remedies in vitiligo in children, sepia. The main remedies here will be of use like sulfur, calcarea, aurum, arsenicum, alumina, sometimes phosphorus, natrium muriaticum, natrium carbonicum, mercury, silica. What is? Syphilinum. You can say yes, but I cannot really see different. I have seen, as I said, some regression in vitiligo, or I have seen a few cases. Maybe there are not 2, there are 4 or 5, but very few cases that I see in grown-ups that the condition was taken away completely. Remedies in psoriasis, the main remedy is what remedy? Is again sepia. Sepia, why? Because sepia produces scaly eruptions, very strongly, dry eruptions, and scaly, dry eruptions. Remedies that produce this state of affairs are good for psoriasis. Which are these? Arsenicum, arsenicum iodine, aurum, aurum muriaticum, barita carbonica, calcarea, calcarea sulfurica, leadum, mesirium, phosphorus, sepia, silica. Vithoulkas also is one of the main remedies. Vithoulkas. Vithoulkas is very much similar with mercury. Lycopodium also, you will see sometimes indicated. In the acute stages, sometimes the psoriasis takes a very severe form where there is inflammation, real inflammation, and you see the inguinal glands get swelled up because of the inflammation going on in the whole body. The inguinal glands become swollen, and there is a burning sensation and an aggressive heat, which is and pain on the whole body. Then that can be alleviated, can be ameliorated by belladonna, and most probably will have to be continued with calcarea carbonica. Another remedy which is also good is clematis. Clematis. Ringworms, did I give you ringworms? I gave you ringworms, huh? No. The main remedy is basilinum here, basilinum. And radium bromatum also, when the eruption is absolutely circular. It's a circular eruption. It's an exact circle. And it appears in different places and becomes an exact circle. That's radium bromatum. Natrum muriaticum also, Vithoulkas, sepia, tellurium also, and tuberculinum, of course, tuberculinum. And then in a lower degree, barita carbonica, calcarea carbonica, and graphites. Barita carbonica, calcarea carbonica, and graphites. Herpetic eruptions that come during fever. If during fever you have a herpetic eruption appearing, then it's going to be natrum muriaticum. And natrum muriaticum also is the main remedies for producing herpes in the lips. If the herpetic eruption appears with a lot of itching, then we have clematis, rastox, and sepia.
Ever treat a case of ichthyosis?
Ichthyosis, yes.
Yeah.
Yes, we treated a case of ichthyosis. Yes, that's another serious state and requires a lot of treatment perhaps, but the main remedy that will almost cure, will almost take care of 50% of the cases is phosphorus. Phosphorus in ichthyosis. Ichthyosis is a congenital disease which is quite severe with a lot of scales. And I remember one of my first cases that needed phosphorus in ascending potencies. And that was the only case that I had to prescribe 4 mm or something like that. Which I don't know now what kind of potency is this. But anyhow, she needed ascending potencies. Unfortunately, we cannot, due to the fact that we do not have a scientifically produced homeopathic remedy. That means we know that this remedy has been potentized 10,000 times exactly. Because of that fact, we cannot know exactly what is happening. When we say we gave CM potency, 100,000 potency, 1 million potency, we don't really know whether this remedy was really potentized 1 million times or it was said that it was potentized 1 million times. But phosphorus, I have noticed that in ichthyosis acts very well, and usually the cases that they need, the ichthyosis cases, they need phosphorus in great percentage.